tricky. So let's establish first layers of the skin, right? So we have the epidermis, which is the top part of the skin, right? Where you have all the keratinized dead cells and all that stuff. Then the true skin, we know that as the dermis. And then the subcutaneous tissue, of course, that's the sub-Q of the hypodermis, right? So let's establish these 3 layers of skin first. Then you have to consider, where do you have the blood supply? We have blood vessels down here, and I'm just drawing blue because it's the only marker I have, okay? But you know we have blood vessels here, and they extend with their capillaries up this way. Now this is important. This is why I was discussing with all the things that I was discussing in the emergent phase and in the acute phase, they only apply when you've burned at least this part and below. It will not apply when you burn the epidermal layer, like a regular sunburn, as bad as it can get. It's not gonna affect those issues. It's not gonna have those issues because you haven't destroyed the part of the tissue that has blood vessels. So that's why I mentioned, if you have a partial thickness burn, which is the 2nd degree, or more, and if it's 20% more, then you have those issues. So let's establish what we call these, right? So when you have a regular sunburn, it only affects the top layer of the skin, the epidermis. It does not include this part right here. We call it a superficial burn. Okay? Superficial burns are very painful, okay? They're very tender, they get red, but when you apply pressure, it blanches, meaning the capillary refill returns. And that lets you know that there's still adequate circulation to the entire part of the skin because this part has not been damaged yet, right? So there's blanching, it's superficial, it's very painful, it's very tender, and it sheds off afterwards. We agree on that? But then you have partial thickness burns, right? Which is this one. Partial thickness. Okay, but there's different types. Okay, actually there's only 2 types. So a partial thickness burns means that it's encompassed the entire epidermis and at least a portion of the dermal layer. And the way we describe that is by a superficial partial thickness burn. Okay, it's superficial, but partial thickness burn. Now, we've established that partial thickness means what? Dermis. But if it's a superficial partial thickness burn, it looks like this, that means that the burn has came all the way down. This is superficial, right? And then superficial partial thickness, this word lets you know it's now entered the dermal layer. So superficial but partial thickness means it's at least encompassed the top part of the dermal layer. And these present usually as blisters. Because you can imagine a blister is considered a partial thickness burn that we used to call it 2nd degree. Because the dermis and the epidermis and the dermis have now detached themselves, and there's fluid in the blister, right? So that's what we call that partial thickness, but it's considered superficial partial thickness burns. Does that make sense, ladies? Okay. And then you have one that goes a little bit deeper, closer to the bottom, all the way to the bottom of the dermal layer. And that's going to be your deep partial thickness burn. Does that make sense? Now, the differentiation between those two is more like for nursing school. When you guys take the NCLEX, if you see partial thickness, the rules that we discussed earlier with the emergent and the 20% body BSA, all that stuff, but in nursing school, that's when you really have to differentiate them. But it's just nice to know because they might tell you superficial partial thickness, that's a blister. So that's important for you guys to know. Make sense? And then you have the type of burns that, oh, and by the way, when you've burned the dermal layer, you're not only burning blood vessels, but you're also you're beginning to destroy nerve endings, but the endings only. And so it's still pretty painful when you have this type of burn, right? But once you get down to the full thickness burns, you have this part right here, the full thickness burns, that's where you have the main source of vascularization and main source of nerve stems. So not the stem cells, but the main branches of the nerves that eventually extend into the skin, they're down here also. So when you have a burn that goes all the way down to the subcutaneous tissue, we call that full thickness burn. And that means that it has destroyed the epidermis, the dermis, the subcutaneous tissue, and now it's destroyed the nerves. So people that have partial thickness burns, they have dull pain, which is just kind of, yeah, it's painful, but it's not sharp, it's not that severe, because all the nerves are destroyed. Does that make sense? And you have to consider that because they might ask you questions that the patient has a burn, this and that is the manifestations. Which one would you report as being the type of burn that they have, the depth? Does that make sense, guys? Continuing, when you could have deep full thickness burns, which includes your bones, exposure to your bones, your muscles, and your tendons. Okay? And so any type of burn that's partial thickness or beyond, infection is a huge risk. Of course, the time frame is 48 to 72 hours or beyond that. So you have to look for things like purulent drainage, pus, stuff like that. Does that make sense, ladies? And so these are the depths. So make sure you guys review them because you have to know those as well. Any questions on these so far?